Good morning. My name's Cleveland Fagan. I'd like to also acknowledge the traditional owners and also each and every leader in the room today. As my chair said, you know, we've come along a long journey over the last 9.5 years. But at the end of the day, the goal that we started with has not been completed. And for me, it's probably more of a personal journey too. And I live in Yarrabah, and one of the key things that I enjoy about living in Yarrabah is that I've got a health service that meets the needs of my community of Yarrabah. And that's the kind of goal that we need to have in every single community in Cape York. Our family, my dad, you know, the little joke in the family is that, you know, our passage of right from, you know, young people to adult is that we've got to go and have heart surgery and have that scar down the front of our chest. Because heart disease in our family is a really bad thing. And if it wasn't for having the right health service in Yarrabah and having a health check and then having the stress test and finding out that I had a blockage in my artery, you know, I probably wouldn't be standing here today. And so that's the thing that we want to achieve as an organisation for every single Cape York community, is that we want to have a health service that meets the needs of every person in that community. With the health service as it stands, it's not really what community need, what community want. A lot of the health services like native title, like land, like economic development is driven by what government policies are in play on that day. Within health, we know that there's a focus around what they call body part health, which means, you know, your eyes, your heart, your ears. But there's really not a policy framework at a national and state level that looks at what Aboriginal people of Cape York need. And so the challenge that we've had as an organisation is actually fighting with government to get a policy that's going to support what we want to do in Cape York. We know, based on what's in the public arena, that there's $127 million conservatively going into health in Cape York. Now, something must be wrong if we can't get better health outcomes for that amount of money. A lot of the money is going into Queensland Health. You know, we're talking about roughly $83 to $89 million. And it's not being used effectively and it's not being used the right way. What that gives us is a health system that is broken and fragmented. A health system that does not respect what Aboriginal people want. I mean, we met with Lockhart Council a couple of weeks ago and the Lockhart Health Action Teams. And this is how stupid it is, because if someone wanted to go and see the doctor or nurse after hours, even though that nurse or doctor might be 2-3 metres behind that locked door there, they've got to ring up 000 that puts them down into New South Wales, that then has to be redirected back to the primary healthcare centre in Lockhart. It's stupid things like that needs to change. But the problem is that because we don't have control over the service, we can't make the changes that we know needs to happen. And as a result of that, when we started to look then at the 7 measures under the Close the Gap initiative, and the first 2 indicators that look at overall health and child mortality, we couldn't even get the data to see how we're going. We could tell you how we were going as an organisation. You know, we're above each of the national performance indicators that we have to report against, but collectively for the 127 million going into Cape York, we couldn't tell you. And there's one statistic that was in a Queensland Health document that has always stuck with me. And it was in the 2009 health indicators that says 71% of deaths from the years of 2002 to 2005 were preventable if the person was identified and treated early enough. So when you look at the numbers of deaths over that period of time, which is about 200, 71% is about 140, 150 people. And so that to me is a sign that the health system is not working, it's not meeting our needs. And so what we as an organisation have been doing is trying to change it based on the directives from community to a service that's going to meet our needs. So the challenges that we have is that we know the current health service is not right. The type of health service we receive up in communities now might suit someone living in Cairns or Brisbane or Sydney, but it's not the type of health service that we need in our communities. Government's not willing to relinquish control. You know, we've had commitments from ministers, we've had commitments from the highest levels of government. But at the end of the day, like Richie said, you know, bureaucrats have a stranglehold on what happens. And the bureaucrats don't want to give up. The bureaucrats want to manage their risk and they want to make their ministers look good. And as a result, we know that with the amount of money going into Cape York, we're not getting the outcomes we need. Health investments aren't being used right. Providers aren't being held accountable. One of the things that I remember is that we were doing community engagement. And I went to Kawanyama, my chairman's community, and you know, we were asked to present to a community meeting. And 120 community mob turned up. And I remember Monty, the ex-mayor, said to me, he said, you know, you come into our community, you do a lot of stuff here, when are you going to come and tell us what you do? So as a result, we go back into the communities every 6 months and we are held accountable back to community for the things that we do in the health area. That needs to happen also with RFDS and Queensland Health and all of the other health providers. The local leaders need to lead. And there's no coordination between what we do in health and what happens in the other social areas. I remember going to Cowan and sitting down with the community there, and they said to me, you know, we can't look out, you know, we don't worry about our health at the moment because at the end of the day we've got this happening, we've got that happening. And until those issues are fixed, health for us is a low priority. And we've struggled to try and deal with it, but it's come a point in time where we know that we need to start working with the other organisations that have the responsibility in those areas. So as an organisation, we've started to look at a framework in terms of how we'll do this. And the framework that we've come up with is based on probably 5 key areas. The first key area is around financial reform. And it's using the $127 million that we know of. It ranges up to $200 million, but using it more effectively. Now, when we started to look at what is the cost of a health service that's needed in each community, it came down to 50–75% of that amount. We need to have organisational foundations, so we've worked very hard to make sure that no one can use the excuse that, you know, Apunipima is just another black organisation. We focus very hard on governance. We focus very hard on ensuring that the services that are delivered by my staff is exactly the same services as someone would get in, you know, the rich areas of Double Bay in Sydney or, you know, down in Brisbane. They're the same services that we have to adhere to. We need to have a health service that meets the need of community, and the evidence says that for a remote community, primary health care is what we need. Not primary care, not going in and having a doctor see your sore foot, but looking at you as a whole and looking at your family. We need to also have a reciprocal accountability framework, and we need to look at how we start to link in with those other social areas that, you know, that people are facing on the ground. And so the linking into the other areas is that we know that health can't be achieved without addressing social issues. So the exercise that we went through is then looking at each of the communities and saying, well, what are the community aspirations? So we looked at local government's 10-year plans. We looked at, you know, the commitments out of the welfare reform, education, policing, safety, housing. And then we said, okay, well, what are the key areas in that each of these aligned to? And it came down to creating healthy and safe communities, creating smart communities, creating a culturally secure communities, creating a community that's sustainable, and creating a community that has real jobs. And so looking then, we know that in health, that this is the role that we play in each of those areas. Now, we've spent a fair bit of time with councils, with our health action teams, looking at, okay, well, is this still the approach that should be taken, or is there new priorities that have come up? And so at the end of the day, we know that then this is what we do and this is how far we go into these other social areas in each community. But at the end of the day, it's not going to be something that we can achieve by ourselves. And so, at the end of it, you know, we have come a long way. We've got more services up there, but it's not the right services that we have. And to be able to do that, we need to control the health system. We need to use the funding smarter. We need the community leaders to be heard and respected. We need to be accountable and to hold others accountable. And we can't do this alone, and we need to work not only with the other regional orgs, but also with you guys, the leaders that are sitting in this room today. And we want to be able to look back, and this is what I keep saying to my wife, is that at the end of the day, I want to be able to look back and say, this is what I've done for my mob in Cape York. And until I can answer that question truthfully, you know, I'll still be here fighting and trying to get the things that's needed in Cape York. Thanks.